Hello again, and welcome to therapy. I want to start off reminding you how brave and strong you are for allowing me to be a part of your journey to accomplish your goals. It may seem like a risk to try cognitive behavioral therapy for the first time, but I applaud you for your willingness to do this. This is a short presentation that I put together for you to have an understanding of what CBT is before we go in, what the goals are, and why this opportunity would be worth it, I think. I want to make sure to reiterate that this is a safe place, and nothing said in our sessions will be shared with anyone else outside the session unless anything pertaining to self harm or harm to someone else will come up. I do hope that you'll walk out of this presentation excited to begin this journey with me. But if for any reason you feel that it isn't a good time or you'd like to try a different method of help, you can let me know at any time. I'm also going to have references to different resources on the PowerPoint, from books to websites to even dictionaries. If you would like to have access to any of these, feel free to ask me and I can send you the information. At the end, I'll make sure to give some time for you to ask any questions you may have, but it's okay if you don't have any. With that, let's begin. To start off, some people might be intimidated when they see cognitive behavioral therapy written out, so I want to break down what each word means. Quote, cognitive, unquote, simply refers to what we think and how we think. We can then assume that behavior refers to anything that a person does. This could be something done with our hands, feet, arms, legs, or something we say. Essentially, if you can see a person doing something, you're witnessing behavior. Therapy can be a loaded term, but it simply means curing, healing, or service done to the sick. The American Psychological Association defines CBT as a psychological treatment used for different problems such as depression, anxiety, alcohol, drug use, and the list goes on. There's a lot that goes into CBT, but the primary theory that drives the treatment is basically what we think about an event or experience affects how we respond to it. Take this example. You don't get invited to a neighborhood friend's party. You might have two thoughts as a result. You might think, quote, they probably forgot to add me, and I have other things to do today. I hope it's a fun time though, unquote. Thus, feeling calm or relaxed. You might also think, quote, they're so rude. How could they forget me, unquote, feeling hurt or angry. Of course, these aren't the only two responses or thoughts a person might have. Everyone feels differently, but this is the driving force behind CBT. The primary goal then is to change the way we think. During therapy, we're going to learn how unhelpful thought patterns create more problems, we'll gain a better understanding of others, use problem solving to cope with hard situations, and ultimately, we want you to be more confident in yourself. That was a lot of information, and some people might think, quote, that sounds nice, but how do I know it'll work, unquote. I brought up a few statistics which might make you more confident. It's estimated that around 60% of adults that get psychotherapy with CBT techniques show significant improvement. Additionally, 70% of people who finish therapy say that they are satisfied with the treatment. Now you might think, quote, I might start off well, but what if things start to get more difficult? Unquote. People who receive CBT only show dropout rates at 20%. In fact, in a span of 46 months, 40% of clients who receive CBT show a 50% reduction rate in depression symptoms specifically. Now that we've covered the basics of CBT, I want to make sure we understand what therapy will look like on a session-by-session basis. Each session, we'll begin with a check-in as well as a mood check to see how your week has been going. During this week, or this time, you will have the opportunity to also show anything important that you'd like me to know, although you aren't required to share anything that you aren't ready to share. We will review how skills were applied, what you're learning, and also discuss any challenges or barriers to learning that we may foresee. We'll then transition into a bridge from last session. During this time, we'll work together to recall what we talked about in the previous sessions and bring it over to the current time. Finally, we'll work together to decide on 1 to 2 specific problems or topics to focus on in that day's session. As a reminder, there will be no pressure if we only work on one problem, or we could even add a third if you desire. During the middle portion of the session, we'll work on those agreed upon topics during using CBT techniques, discussing challenging situations, and new ways of thinking and behaving. You may be asking, quote, what kinds of techniques are you referring to, unquote. There are so many that we could cover, including worksheets, muscle relaxation, and journaling, just to name a few. But it all depends on what you feel like works for you. And there's no harm in trying, or we could try if you would like. Finally, we'll end our therapy assignments with assigning homework. Now, I know how that sounds. You might have remembered all those assignments you had to do in school, all the stress added from those experiences. It's not really that kind of homework. I won't be grading you. What I'm referring to is one or more activities that we'll agree upon together at the end of our sessions that you can practice in between meetings to reinforce learning. You can work on them at any point during your week, and we'll also be working on these skills during our sessions together. One therapist, Dr. Andrea Zorbis, said, "CBT homework assignments are the bridges to daily life," unquote. I know that may sound intimidating, and some activities may seem too difficult to do. One tip that might help is to use the 5-minute rule. Essentially, blocking out just 5 minutes per day to work on a particular skill. We'll wrap up our session in the last 10 minutes by reviewing key takeaways, and then will be a time for you to provide feedback to me. We're both growing, and together, and I want to make sure that I'm giving you the best help for you. All right, I know I've been talking for quite a bit. I want to end off by reminding you once again how incredibly proud I am of you stepping into this journey and being willing to try CBT. It takes a lot of strength to be able to recognize that you need help, and again, I'm just so proud of you for recognizing that. It also takes a lot of bravery. As I said, a lot of people go into this nervous. It's not uncommon for that. But it's so great that you're willing to try. It may take some time to get used to, and that's okay. One of my favorite books on CBT, Mind Over Mood, asserts that developing skills takes 3 things: practice, patience, and perseverance. The more time you spend practicing, the more benefit for you, and how fast you learn is not the most important thing. I'll say that again. How fast you learn is not the most important thing. I hope that all this information, though I know it's a lot, made you more confident in CBT. And if not, that's perfectly okay. With that, I'll open this time if you have any questions. And thanks for listening.